Welcome to China Truths. In this episode, we will bring you the following story. Mainland China's major hospitals undergo massive salary cuts, doctors lament hardship. Now, let's dive into the details. It's all covered in today's China Truths. Mainland China's major hospitals undergo massive salary cuts, doctors lament hardship. Due to economic stagnation, waves of layoffs and salary cuts are sweeping across China, impacting even the healthcare system. A shortage of medical insurance funds has led to salary reductions, or even unpaid wages, in top-tier hospitals in multiple regions. The winter in the healthcare system has left many medical professionals lamenting their hardships as the year comes to a close. On December 7th, a blog post titled "Discussion on Salary Cuts Among Medical Staff in Shanghai" revealed that many healthcare workers reported salary reductions at their institutions. Cuts range from 15% to as high as 80%, with standardized training, residency, staff seeing a 50% reduction. Some hospitals have even changed their schedules from a 5-day workweek to 6 days, requiring full shifts on Saturdays. One doctor from a second-tier hospital in Shanghai's Huangpu district reported that their salary had already been reduced by 1/3, with further cuts anticipated next year. Aesthetic medicine practitioners in Shanghai complain that, beyond salary reductions, they face increased workload pressures, including participating in competitions, performances, and public science campaigns. In Shanghai's Baoshan district, community hospital staff reported an annual income reduction of at least $2,748. Employees of community hospitals in Hongkou district faced reductions as high as $8,244, while nurses in Yangpu district said their income dropped by over $6,870. The steepest salary reduction came from a physiotherapist, who shared on December 12 that their monthly income had dropped from $1,374 to just $275, a staggering 80% cut, starting in March. Doctors at a second-tier hospital in Shanghai revealed that even holiday bonuses had been eliminated. One remarked, "Hospitals across the board are cutting wages by up to 30%. With the overall economic downturn, how can hospitals not follow suit? Many hospitals are even shutting down. The financial strain affects the entire system." Doctors at top-tier hospitals in Anhui province report that salaries have not been paid for 6 months, forcing some to seek alternative means to support their families. One Anhui doctor posted on December 8, "Are there any pediatric clinics hiring? I work at a provincial top-tier hospital, but I haven't been paid for 6 months. I need to earn money to support my family." The post attracted widespread attention from peers and patients, who offered advice and shared similar experiences. An early career medical worker in Anhui stated on December 10, "Hospitals initially pay for treatments covered by medical insurance, expecting reimbursement later. But now, medical insurance is not paying hospitals, which leaves no money for salaries. I've only been working for a year, and my performance pay has been delayed for months. I'm now relying on family support and even considering changing careers." Another Anhui doctor lamented the situation, "The harder you work, the more deductions you face. And during this season, when patients are flooding in, I'm seriously considering leaving the profession." Doctors explained that the financial strain is worse at larger hospitals, which often handle more expensive treatments and complex cases. The inability of top-tier hospitals to pay salaries has shocked the public. A small business owner in Shanghai remarked, "This is unbelievable. Pediatric hospitals are packed, with a simple cold treatment costing families hundreds of yuan, yet pediatricians aren't getting paid. If medical insurance ran out of money mid-year, can we even rely on pensions in the future?" As early as November 29, discussions on social media indicated salary cuts in Guangdong's top-tier hospitals. A doctor at a Shenzhen hospital confirmed their income had decreased for 4 consecutive months. A healthcare worker at a provincial top-tier hospital in Guangdong reported, "Last month, my salary was reduced to 65% of the original amount, and this month it's just 50%. They added that both tenured and non-tenured staff faced cuts, primarily to performance-based pay. Doctors at private hospitals in Guangzhou also reported 2 rounds of salary reductions this year. Some medical professionals expressed anger over declining salaries and deteriorating conditions. A pathology worker at a women's and children's hospital in Guangzhou, who joined in July, revealed they received only $55 this month and are considering resignation. Doctors in Guangdong also criticized hospitals for continuing to invest in expansion projects despite financial troubles. One commented, "Hospitals are constantly expanding and renovating but can't even pay their staff." A Shenzhen doctor remarked, "Salary reductions hit first in major cities like Beijing, Shanghai, Guangzhou, and Shenzhen. This month, there's been widespread discussion in my department. With a salary cap of $2,198 and a $2,748 mortgage, I might have to pack up and return to my hometown." Many doctors attribute the current crisis to the financial collapse of the medical insurance system. For example, Guangdong reportedly redirected significant funds to support insurance systems in other provinces, such as Shandong and Heilongjiang. A doctor in Guizhou confirmed on December 12 that their hospital had suspended salaries starting this month, likely due to medical insurance payment delays. Doctors also criticized the excessive penalties imposed by medical insurance bureaus. For example, Jiangxi doctors pointed out that hospitals rely on advance payments to cover operations, yet medical insurance reimbursements are delayed or deducted. The financial woes of China's healthcare system highlight the broader economic challenges facing the country. As hospitals grapple with unpaid salaries and dwindling resources, medical professionals are left struggling to sustain themselves while maintaining patient care.